When you were younger, going 2 or 3 rounds in one night felt effortless, right? But now, after one orgasm, it's like your system just powers down. You want to get hard again, but your body says, not today. Disclaimer: this video is for educational purposes only and does not substitute any medical care. Always seek advice from your doctor before making any changes or decisions regarding your health. Welcome to Health I Seek. If you are concerned about maintaining a healthy lifestyle, you are in the right place. Kindly like and subscribe to my YouTube channel for more informative weekly videos where we discuss the latest health tips and research. In this video, we're going to look inside your body and unpack the science behind why this happens, what's really changing with age, and how you can naturally recover faster, last longer, and bring back your stamina. Stay till the end, because I'll show you exactly how to rebuild your performance step by step, without pills or gimmicks. What's actually happening? The refractory period. After ejaculation, your body enters what's called the refractory period. It's basically your body's recovery window. During this time, it becomes difficult and sometimes impossible to get another erection or orgasm. For women, that recovery time is often seconds. For men, it can range from minutes to hours, depending on hormones, circulation, and overall health. In your teens and 20s, testosterone levels are sky high. Your blood vessels are flexible, nerves are sharp, and your recovery can be lightning fast. But as you move through your 30s, 40s, and beyond, things begin to slow down. Testosterone starts to dip about 1% per year. Blood flow weakens due to stiffer arteries. Nerves become less sensitive, and your body just takes longer to bounce back. That's why what once felt easy now takes more time, or might only happen once per day. But the good news is, you can influence this process. Once you understand how your body works, you can train it to perform better again. What happens inside you after orgasm? Let's break down the hormonal changes. Prolactin spikes right after orgasm. It's the hormone that tells your body, we're done for now. Dopamine, your excitement and motivation chemical, drops sharply. Oxytocin, the bonding and cuddle hormone, rises, making you feel calm and close but less sexually driven. Meanwhile, your testosterone levels determine how quickly you can recover. Higher T equals faster recovery. Lower T equals longer downtime. The trick is not to fight this biology, but to work with it and boost what supports it. Science-backed ways to recover faster. Get your blood flow right. Good erections rely on strong circulation. Cardio and strength training increase nitric oxide, the compound that helps blood flow to the penis. Just 30 minutes of walking or lifting weights 5 days a week can transform your performance. Raise testosterone naturally. Your daily habits control your hormones. Keep your waistline in check. Belly fat converts testosterone into estrogen. Eat foods rich in zinc, omega-3s, and magnesium like salmon, eggs, nuts, and seeds. Prioritize sleep. Most testosterone is made at night during deep sleep. Manage stress. High cortisol levels sabotage your hormones. Avoid common recovery killers. Right after sex, avoid alcohol. It shrinks blood vessels and lowers T. Smoking. It cuts oxygen to your tissues. Heavy meals. Your body shifts blood flow to digestion instead of recovery. Train your pelvic muscles. The pelvic floor muscles control erection and ejaculation. Simple Kegel exercises, tightening and releasing those muscles for 5 to 10 seconds, can build strength and endurance. Edging, or stopping before climax, also improves stamina and control over time. Learn the perineal pressure technique. There's an area between the scrotum and anus called the perineum. Pressing gently on this spot just before climax can temporarily stop ejaculation. You still feel the pleasure, but without releasing, which often keeps your erection firm. It takes practice, but can greatly reduce the recovery period. When to get medical help. Sometimes the problem isn't just aging, it's circulation, nerve function, or low hormones. In those cases, Treatments like testosterone therapy, L-citrulline, L-arginine, or medically approved pills like sildenafil, Viagra, may help. In fact, research from Oxford University found that men who used sildenafil cut their refractory period from around 10 minutes to just 2, but don't self-prescribe. These medications can interact with heart or blood pressure drugs, so always talk to your doctor first. Don't ignore the psychological side. Sometimes, the reason you can't go again has nothing to do with your body. If your relationship feels predictable or stressful, your brain simply won't trigger the same arousal response. Try to reintroduce novelty and anticipation, flirt, plan a romantic evening, or change your environment. Emotional connection and excitement have a direct biological effect on arousal. Bringing it all together, your refractory period isn't a sign of failure. It's a normal part of male physiology that naturally lengthens with age. But with the right habits, you can dramatically improve your recovery and performance. Remember, the goal isn't to go endless rounds. It's to make every round more satisfying, confident, and connected. You're not broken. Your body just needs better maintenance. And with the right science-backed steps, you can feel strong, energetic, and passionate at any age. If you found this video helpful, hit subscribe for more men's health and vitality insights. And if you want to learn my top 8 doctor-approved techniques to last longer, completely naturally, watch the next video right here.